Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province this afternoon are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honourable Blaine Higgs, Premier of New Brunswick.
Hello, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honourable Premier, Blaine Higgs. Dr. Russell.
Thank you, Bruce. Merci. Bon après-midi à toutes et à tous. Good afternoon, everyone. Over the last several days, we have observed a troubling trend. The emergence of new cases of COVID-19, not only in the areas now under public health restrictions, but in every region of New Brunswick, and these include variants of concern. These cases originate with someone who has traveled outside of the province, and often are people who were not traveling necessarily for essential reasons. En temps de pandémie,
During a pandemic, all travel is inherently risky. For many, the risk is necessary. They travel because their jobs demand it or because our economy requires that it happens. But for now, travel for leisure is a risk that no one should be taking, and yet it is still happening.
people leave the province to visit family and friends, spend time in a warmer climate, or just to get away. When leisure travelers return to New Brunswick, our mandatory order requires that they self-isolate away from others and submit to regular testing. It is very important that those who are required to self-isolate do so correctly, away from others in a separate dwelling so that the virus cannot spread through casual contact. But judging by the new cases of COVID-19 we are seeing and the patterns of infection that have emerged, this is not happening as consistently as it should. This is leading to new cases and new secondary infections in every region of our province. Right now, every region of the province except Zone 5, the Campbellton-Restigouche area, has at least one active case of COVID-19. 4 zones have 10 or more active cases, and these new cases come from travel. L'émergence des variants.
The emergence of more contagious variants of the virus makes our situation more difficult and complex. With the original strain, people might have been able to self-isolate in the same house without others becoming infected.
New strains, infection under those circumstances is almost guaranteed. Until the majority of us have been vaccinated, unnecessary travel is simply too risky. If you do not have to travel, please stay home. If you decide to take that risk, against public health guidance and advice, we need to be sure that you are not putting the health of other New Brunswickers in jeopardy or our healthcare system. Premier Higgs will have more to say on this in a few minutes. Today, Public Health has confirmed 16 new cases of COVID-19 in New Brunswick. There are 8 new cases in Zone 6, which is Bathurst and the Acadian Peninsula. Each of these cases are directly related to travel outside the province. In Zone 1, which is Moncton and Southeast New Brunswick, there are 4 new cases today. 3 of these are related to travel and 1 is currently under investigation. In Zone 2, which is St. John, Kings, and Charlotte counties, there are 2 new cases today. Again, these new cases are directly related to travel. There are also 2 new cases today in Zone 4, which is the Edmundston-Grand Falls area, and these are contacts of a previously identified case. 11 of today's travel-related cases are New Brunswick workers who are currently isolating outside of the province. There are now 148 active cases of COVID-19 in the province. This includes 13 people currently in hospital, of whom 5 require intensive care. And we get reports from the hospital every day about their status, who's stable, who's deteriorating, who's getting off a ventilator. It's a day-to-day report that is quite critical to understanding how things are going with our response and at the most dangerous part of somebody's illness with COVID-19. And while we give you these numbers of active cases and the data, the numbers and what policy decisions we're making, there are people that are hanging on to their lives right now by a thread. So we want to keep those people in our thoughts and prayers. Aujourd'hui, Santé publique confirme.
Today, Public Health has confirmed 16 new cases of COVID-19 in New Brunswick. There are 8 new cases in Zone 6, which is the Bathurst and the Acadian Peninsula. Each of these cases are directly related to travel outside the province. In Zone 1, which is Moncton and Southeast New Brunswick, there are 4 new cases today. 3 of these are related to travel, and 1 is currently under investigation. In Zone 2, which is St. John, Kings, and Charlotte counties, there are 2 new cases today. Again, these new cases are directly related to travel. There are also 2 new cases today in Zone 4, which is the Edmundston-Grand Falls area. These are contacts of a previously identified case. 11 of today's travel-related cases are New Brunswick workers who are currently isolating outside of the province. They are included in New Brunswick's case count. And there are now 148 active cases of COVID-19 in the province. This includes 13 people currently in hospital, of whom 5 require intensive care.
These New Brunswickers need your support, and I ask that you keep them in your thoughts and prayers as you go about your day. And I think that we do talk a lot about the negative things that are happening, and I know it's really important to hear those good news stories. And with each day, one of those good news stories is about the fact that more and more New Brunswickers are being vaccinated and getting their first dose against the virus. And another good news story, we have 30% of the population have had at least 1 dose of the vaccine, and that percentage is increasing at about 1% per day. And we know that vaccines potentially reduce the incidence of infection, but more importantly, they minimize the risk of severe illness, hospitalization, and death related to COVID-19, which means that it prevents our hospital system from being overwhelmed. So the more people that are vaccinated, the better. We are working to get as many New Brunswickers vaccinated as quickly as possible. We know that not everyone can get to a pharmacy or a vaccination clinic. Les citoyens du Nouveau-Brunswick.
New Brunswickers who are homebound due to physical or psychological illness also need to be vaccinated for their own protection as well as that of their loved ones. I know that in many communities, volunteers are providing drives to vaccination clinics for those without transportation. I thank those who are doing this.
For people who cannot leave their homes under any circumstances due to their physical or mental condition, additional measures are required. Through a partnership with Ambulance New Brunswick and the extramural program, a process is being put in place to identify those who cannot leave their homes for medical reasons and providing them with an opportunity to get a vaccine. Persons over the age of 55 who are homebound for medical reasons are eligible for this program. A homebound person's primary care provider can apply to the extramural program for assessment, with referrals to be taken beginning the week of May the 3rd.
Current clients of the extramural program will also be assessed to determine if they qualify for this assistance. The vaccines will be provided as supplies of vaccine that do not require special storage and handling become available.
By providing a vaccine at home to those who are unable to get out for medical reasons, we will be helping to assure that no New Brunswickers are left behind in our journey through this pandemic. And I want to offer my thanks to every New Brunswicker who is helping us get through this stage of the pandemic right now. By getting vaccinated, when your turn comes up, you are doing your part. By wearing your mask when you're out in public, you are doing your part. By not traveling outside the province, if you do not need to travel, you are doing your part. And if you do have to travel and come back and self-isolate safely and you don't infect others, you are doing your part. So by staying home when you don't feel well, you are also doing your part. Getting tested when you have symptoms is also doing your part. So even no matter how trivial the symptoms are, getting tested is very, very important and is really contributing to you doing your part, as well as protecting your community and the hospital system. So if we all continue to do these things for a few more weeks, and I mentioned the target date of about 10 weeks from now before we get everybody vaccinated with their first dose, we will all be in a better position to keep COVID at bay. By maintaining these practices, you will help us get through the next stage of our pandemic journey. Thank you very much.
Good. Good afternoon. Bonjour. Since this pandemic began, we have known that COVID-19 is spread through the movement of people. The more we have been able to reduce the movement of people, the slower the spread to the virus. This is even more critical now.
This is even more critical now since the appearance of new COVID-19 variants because they can propagate and spread faster and more easily. We have seen this situation play out in other provinces. Even though it is impossible to completely stop travel within and outside of our province, we need to take measures to limit the spread of this virus while we continue to vaccinate people.
Currently, 31% of New Brunswickers have received at least the first dose of the COVID-19 vaccine, and we are increasing that number at a rate of approximately 6,000 to 7,000 per day. We feel that by late May, we will be in a better position as a province to be able to keep residents healthy and safe while not putting undue strain on our healthcare system. To give our province the time and space required to be in a better position, Cabinet and the All-Party Cabinet Committee on COVID-19 have agreed to the following isolation recommendations. Effective at 11:59 p.m. on Saturday, all leisure and non-essential travelers, every person approved to move to New Brunswick, and all business travelers who are not rotational workers, truckers, or commuters will be required to isolate for at least the first 7 days of their 14-day isolation in an isolation hotel at their own expense. This rule applies regardless of whether or not the traveler has been vaccinated. Isolation hotels will be located in Fredericton, St. John, Moncton, Miramichi, Bathurst, Campbellton, and Woodstock. Currently, there are no isolation hotels in the area under lockdown. These hotels will be coordinated by the Canadian Red Cross, which will also provide meals, attend to medical needs, and provide 24/7 security. It is expected that the cost to each traveler will be about $200 per day. For direction on which hotel you should go to upon arrival, call the travel registration number at 1-833-948-2800 and an agent will assist you. On day 5 of the hotel isolation, the traveler will take a COVID-19 test, with the results expected on day 7. If the traveler tests negative for COVID-19, they can finish their 14-day isolation at home, as long as no one else is there, and on the condition that they must also test again on day 7, on day 10. Travelers must travel from hotel to home alone or by taxi, but always following the public health measures when they are traveling. No family pickups or carpooling is permitted. Peu importe.
Regardless of the federal government isolation requirements for travelers, once you enter New Brunswick, you will have to strictly follow these requirements.
Practice of hotel isolation is expected to remain in place until late May. Also effective on Saturday at 11:59 p.m., new rules will apply to every New Brunswick resident who leaves and returns to the province on a regular basis, including truck drivers and commuters, with the exception of rotational workers. Once they return to New Brunswick, this group of travelers will need to stay at home, except as needed, to meet medical needs or to obtain the necessities of life, as long as they can do so without contact with others, such as by using curbside pickup or delivery.
This rule applies regardless of whether or not the traveler group has been vaccinated. People who are part of the household of such traveler don't have to stay at home, but they should limit their contact with the traveler because there are risks associated. They should avoid any contact as much as possible for safety reasons.
After 14 days at home, truckers and commuters can leave their home as their health zone phase allows. All of these isolation requirements will be reevaluated weekly but are expected to remain in place until near the end of May. Upon their return to New Brunswick, rotational workers will need to self-isolate for 14 days. If they choose to isolate with their family, then everyone must self-isolate for the full 14 days. Like everyone who is coming into New Brunswick, truck drivers will now need to register to enter the province.
You will be able to register at the border, but it will slow you down. You might want to register online in advance.
There will also be an increased presence of peace officers at Olac on the border between Nova Scotia and New Brunswick. Students returning to New Brunswick from anywhere in Atlantic Canada that is considered to be in a hot zone, currently this includes the Halifax Regional Municipality, as well as anyone who is with them and helping them move, must self-isolate for 14 days, effective immediately. As of Sunday night, at midnight, students returning to the province from a hot zone will be required to isolate in a designated hotel at the province's expense. As with other groups, they will be tested on day 5 with the option of finishing at home starting day 7 if the test is negative. This program will be overseen by the Canadian Red Cross, and information will be provided when students register to return to New Brunswick. Minimum fines are increasing from $292.50 to $580.50 for those who violate the mandatory order. And I appreciate, while in many areas throughout our province, in most areas, we have a high degree of compliance, in the 90%, 95%, sometimes higher. The criticality of the situation today necessitates an urgency around any non-following of the rules. We must ensure that we are following health rules like never before, because a single miss can have such a dramatic impact on our entire province. There are also, we know, some that aren't taking the situation seriously. And while, as Dr. Russell explained yesterday, and while the COVID rules that we have in place may have been extremely effective with COVID as it once was, with the variant, it is much more critical for us to take additional due care and attention. I understand that we've provided a lot of information today. We've done so quickly. We've spent time with our COVID cabinet colleagues and our cabinet colleagues, and we've certainly reacting to the situation that we're finding, not only in New Brunswick, but throughout the region. What we're seeing right now in Nova Scotia, what we've been seeing for weeks in Ontario and in Quebec, and we have 10 weeks in order to achieve success here. We have vaccines that are coming now at an unprecedented rate to what we had seen in the past. We can vaccinate 45,000 a week easily, and we can go beyond that if the vaccines allow that to happen. We're optimistic we will be able to increase our capability because vaccine supply will also increase. But right now, if you don't need to come to New Brunswick, don't come here. We want you, just not right now. If you can delay your move to our province by a month or so, then please do so. If you don't need to travel, stay at home. If you are, for example, currently at a resort in Florida and are able to stay there for another month, please do so. The risk to you and to everyone you come into contact with is simply too high. Back when this pandemic began, the federal government, along with our provincial government, sent a clear and consistent message. Do not travel. This
message has not changed. If you made the decision to travel after being asked not to do so, then you made the decision to increase your chances of catching the virus.
We are trying to minimize the risk of you bringing the virus to New Brunswick and spreading it further. The plan is not perfect, and we're still working out the details, but these steps are necessary.
Our goal is to keep our province in the yellow phase as much as possible. At the same time, we are doing everything we can to make sure that our healthcare system does not become overwhelmed.
We are seeing that happen right now in Ontario, where healthcare professionals are being forced to make heartbreaking choices about who receives care and who doesn't. We cannot let that happen here. These isolation requirements are not forever, and we must realize, although we're all tired of COVID, we just need to stay vigilant, and we just need to do so for another 10 weeks at minimum. But we know that we will need to continue as we all get vaccinated. But I'm still counting on summer. And right now, summer starts July 1st, and that's going to be our focus. But can we achieve it? We can only do it together. And we can do it if we're vigilant, and we can do it when you take vaccines when they're offered to you. We need to reach that threshold. In approximately 30 days, we hope to be in a place where we're able to ease restrictions or to reevaluate our situation. De plus, nos
Furthermore, we will be reevaluating regularly the restrictions, and we will make the necessary changes to keep New Brunswickers healthy and safe.
Today, Cabinet and the All-Party Cabinet Committee on COVID-19 also made the decision that high schools will not be returning to a full-time in-person learning this school year. Given what is going on around us, it just didn't make any sense to change at this time. I want to take this opportunity to thank all the healthcare professionals in our province and those who have recently stepped forward and offered to go to Ontario to assist that province with their response to COVID-19. I am proud to say that New Brunswickers are always ready to help out in any way they can, and we continue to demonstrate that in every way. Of those who have expressed interest, we've identified approximately 27 who have looked at going, and they're being evaluated now in terms of the needs in Ontario and in terms of their availability. We will be forwarding a list of available resources to Ontario today through our mutual aid protocols and anticipate that some of these people will be called upon in the coming days based on the need in Ontario. I also want to thank the truck drivers who continue to work so hard to keep goods flowing into and out of our province. It is important that the truck drivers who regularly cross borders into other provinces and the United States remain healthy. That is why we continue to make them a priority and have even increased that in the last several weeks. I am pleased to report that more and more truckers have been signing up to get vaccinated. Truckers, thank you for your service throughout this pandemic as we continue in these late stages of the pandemic and the view to looking forward to better results in the near weeks and months. Please continue to protect yourself and to get vaccinated. And although the current rules and the changing rules are not easy, we respect that. But it's all in an effort to keep you safe and to continue to keep our residents safe. Unfortunately, travel-related cases of COVID-19 continue to increase, and the variants are putting New Brunswickers at risk. By taking swift and decisive action, we will reduce the risk of infection and protect lives while we continue our vaccine rollout. Rien de tout cela.
None of this has been easy, but we are making progress. I would encourage everyone to continue to work together to make sure that they are healthy and safe, and to make sure that their loved ones and their communities are too.
If you are eligible for a vaccine, make your appointment and get one. Thank you. Merci.
Merci beaucoup, Premier ministre Dr. Russell. Thank you, Premier Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Chaque journaliste aura une question. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Voulez-vous assurer de désactiver le son de vos micros, s'il vous plaît? We'll now proceed with questions from members of the media. Each reporter will have one question. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Harry Forstall,
CBC.
Harry Forrestal. Nick Moore, CTV.
Thank you very much. This recommendation that is changing about AstraZeneca this afternoon, that it can now be offered to people 30 plus, how is that going to affect the rollout of the vaccine in New Brunswick?
Hi, Nick. Well, as of right now, New Brunswick is going to stay the course with the 55 plus. All of our clinics really with AstraZeneca have been planned out with that age group in mind. We won't be getting any more AstraZeneca till probably the end of May at this point in time. And as of right now, we're going to use the risk-based approach that is recommended by NACI around our epidemiology. So as of right now, again, we're going to stay the course and see what things transpire over the next several weeks. But again, we won't be getting any more AstraZeneca till the end of May.
Adil Ibrahim, CBC.
Thank you. This question is for Dr. Russell. Can you explain again what percentage of vaccinated people will mean we've reached herd immunity, and what will continue to be prohibited until we reach that 75%? Or whatever it is.
So it's a bit of a moving target. Prior to the variants of concern being at play, I think we were looking at something like between 60 and 70%. Now that the variants of concern are at play, we're looking more at 75%. But again, that can keep changing based on what we get from other jurisdictions who have completed their vaccination. So places like Israel, their whole population is probably at herd immunity right now with respect to their 2 doses of Pfizer being on board. So the data that we're getting from places like that in terms of what kind of breakthrough infections exist, et cetera, that will tell us what types of public health measures will remain in place and which things can be relaxed.
Thank you. Callum Smith, Global News.
Hi there. Premier, I'm wondering how the decision was made for the hotel isolation requirement, and I guess how you expect that to evolve moving forward.
Well, certainly the decision was made because of what we're seeing around us and the rapid explosion of cases when a single, let's say, variant, particularly related infection, shows up on the scene. We've had some cases of that where isolation was supposed to have happened and it did not. Obviously the tremendous high percentage of our cases are travel related, and so to ensure that we do not miss travelers, and to ensure that they do isolate as required. We believe this protection is required, and that's why it became a consensus within our team and the COVID cabinet and cabinet committee that we just must exercise everything we can right now to minimize exposure. If we were back to COVID as normal, we probably would have said, well, we can carry on as we have been because that's been successful. But right now, we have seen, and I've referenced them today, the situations and how quickly it changes. So we're at the home stretch. We've got, the 10-week until we believe we can be in a position to have 70, 80% of our population with at least the first dose, which can be a game changer for us. And so people just need to, take this last kind of interruption in our life and say, look, we can do this, we can bear down, and we've got to do everything. We can't look back in a few weeks' time to say, what else could we have done? We want to always be able to look forward and say we did everything when we needed to do it at the time we needed to do it. And as a result, in July 1st, summer is returned to New Brunswick.
Michel Corriveau, Radio-Canada.
Hi. This is a question for Dr. Russell. The Premier explained pretty clearly what the new rules would be as of Sunday midnight for travelers. Could you explain for your Francophone public what these new rules will be? What will be implemented as of Sunday at midnight? So I think for people who are traveling for non-essential reasons, as of April 24th, 11:59 p.m., they will have to isolate in a hotel for 7 days. On the 5th day, they will take a test. And after that, they can finish their self-isolation at home. For workers who are not rotational workers or truckers or commuters, so these rules will begin at 11:59 on April 24th as well. It's these 7 days in a hotel with a test on the 5th day. And after that, they have the option to finish their isolation at home. For students who are studying in other Atlantic provinces, here are the rules. If they are coming back before April 25th, 11:59 p.m., the rules will be as they are now, but after April 25th, 11:59 p.m., they will have to do their 14 days of self-isolation at home. People coming from Atlantic provinces, but who are specifically coming from hot zones like Halifax, and effective immediately, when they come back to New Brunswick, they will have to self-isolate from home. And if they're coming into New Brunswick from a hot zone after April 25th, then they will have to do their 7 days of isolation in a hotel, get tested on day 5, and then they can finish their isolation at home after that. Students coming from elsewhere in Canada will have to do their isolation in a hotel as of April 24th, 11:59 p.m. As I've said, that's 7 days in a hotel, a test on day 5, and then the option, if the test is negative, to finish the 14 days isolation at home. People who are traveling for compassionate reasons, who are already outside of the province, will have to do their self-isolation at home for a period of 14 days. As of April 24th, 11:59 p.m. For people traveling outside of New Brunswick for compassionate reasons after April 24th, then when they come back, they will have to isolate for 7 days in a hotel, a test on day 5, and then if it's negative, then they will finish their isolation at home. For people traveling outside of New Brunswick for medical reasons now, or for child custody arrangements, there are no changes. Now, people traveling outside of New Brunswick, there are people who are currently isolating outside of the province. They will have to get tested. And when they return to New Brunswick, they will be like a rotational worker. So they have to do their self-isolation here in New Brunswick in a hotel and do a test on day 5. For people traveling from abroad internationally, once they've done their hotel quarantine and gotten a negative test, they will have to do 14 days here in New Brunswick in a hotel, and that is effective as of April 24th. For international travelers who will be doing the 14-day self-isolation in a federal quarantine facility, they won't have to self-isolate in New Brunswick after that. Telegraph Journal.
Hi there. My question is for Dr. Russell. I'm wondering if you can quantify how much of a problem these leisure travelers are actually creating. Do you have, the percentage of cases this month specifically from leisure travel, and on average, how many people became infected from those leisure travelers?
So we actually have the percentage of cases that come from all the different types of travel, how many and how many secondary cases they generate. So we have that data on all travelers for the last several months. And basically the risk, because of the variants of concern right now, are much more elevated than they were prior to the arrival of the variants of concern. So anything that we can do to mitigate those risks right now, anything that we can do to minimize those risks, translates into, very directly, fewer cases that are hospitalized, and fewer cases that are requiring ICU and ventilation, and fewer deaths.
Ms.
But
Vicky
I'm not
Hogarth,
asking for
CHCO.
travel related, I'm asking for leisure travel related specifically.
I do have that data, and we can provide that to you, so we can check with Bruce after.
Vicky Hogarth, CHCO TV.
Thank you, Bruce. Dr. Russell, what do we know at this point about the B1617 double mutant variant first detected in India? What exactly does double mutant mean, and are vaccines less effective against it? And is its presence in Canada part of the new travel restrictions?
Hi, Vicky. So what we know about the variant from India right now, all variants of concern meet the same criteria around being more aggressive, being more contagious, and causing more symptoms that are more serious, requiring hospitalization and ICU admission and possibly death. The other thing that all variants of concern share in terms of what meets the criteria of a variant of concern includes the risk of not necessarily being as that vaccines may or may not be as effective against them. So these are risks that we take very seriously when we're looking at variants of concern, and the fact that the UK variant took over in the UK very quickly. It's now the dominant variant in Ontario. The Brazil variant has arrived in British Columbia, and now we're seeing the India variant in several provinces of this country, and we do anticipate that it will do the same as the other variants in terms of taking over as the dominant strain. The fact that the India variant has 2 different mutations on it that make it more contagious, more transmissible, have more severe symptoms, requiring more people to be hospitalized, is very, very concerning, because we already have been dealing with the UK variant in Zone 4, which has put more people in the hospital, requiring ICU admission and ventilation, etc. So we are definitely very concerned, and those risks are much higher right now, and therefore all the things that we need to mitigate those risks have to match that. And so that's why we are putting all of these measures in place right now.
Thank you. Simon Delatte, l'Acadie Nouvelle.
My question is for Dr. Russell. I'd like to know, it seems that vaccine clinics seem to be less full in Zone 4 this week. Is public health considering extending the vaccination to other categories? A large chunk of the population has already received a dose in Zone 4. I don't know if I fully understood your question. You want to know if some vaccine clinics are full? Because we know that we are directing vaccines towards Zone 4 because of the outbreaks. We will continue to redirect a percentage of our vaccines as we can, but for the time being, I think that vaccination clinics are almost full. Would you consider extending vaccination to other population groups in Zone 4? There are spaces available for tomorrow, I believe. But you want to know... I don't understand your question, I'm sorry. Simon? Can you wait? We'll move on to another question. Harry Forrestal, CBC.
Thank you, Bruce. Thank you, Premier and Dr. Russell. Premier, yesterday you made remarks regarding the number of long-term care workers who have been vaccinated. You said only 59% of LTC workers have agreed to be vaccinated, which suggested there was resistance there. Perhaps they were refusing. I spoke today with the Nursing Home and Long-Term Care Homes Association. They say that it isn't that workers are refusing, it's that unlike other jurisdictions, workers at LTC homes and nursing homes weren't among the first to be offered vaccine, and there are a number of difficulties that have contributed to them not being able to get vaccines. Can you tell me what solution the province has to this particular problem of a third of the workers who care for the most vulnerable in the province have not or may not be able to get vaccines?
Well, firstly, I'm glad to hear the response that it's not about individuals refusing, it's about having the opportunity for vaccines, because we have the vaccines available. Just like they were available to the home care workers at the time that the long-term care workers were being treated. The whole staff were being treated at the same time and vaccinated. So the supplies have been available, will continue to be available, and now we're contacting each home. And I would say have the homeowners and management contact us if that's, because we'll be on their doorstep with vaccines or be showing them directly where to go. Because if we're fully aligned, which it's wonderful news that the home care workers want to, or the healthcare workers of long-term care facilities want to be vaccinated, we want them to be vaccinated, so we're all on the same page. And if there's a concern that they didn't have that opportunity, well, we'll remedy that, because we have lots of vaccines to ensure they are vaccinated, because healthcare workers, long-term care workers were a priority from very early on in this process. So great to hear. We'll certainly focus and work with them very closely.
Sophie Deshotel, Radio-Canada. Stefan Sinclair Fortin, all New Brunswick.
Hi, this question is for Dr. Russell. I was just wondering if you could tell me how much AstraZeneca the province has left in stock, and if the province is having any trouble getting rid of it.
We definitely are not having trouble getting rid of it. We don't have a ton of it left. I think there was only about between 1,200 and 2,000 doses left before the next shipments are expected, and those clinics are all scheduled. And my understanding is they're not having trouble filling them up.
Thank you. Sophie Deshotel, Radio-Canada.
My question is for either Dr. Russell in French or Mr. Higgs in English. Why are there no hotels in Edmundston? And also, I'd like to understand how you'll do the check to make sure that people will, in fact, be going to a hotel. What kind of controls and checks will there be in place to make sure that this rule is followed?
The only reason there's not one in Edmundston right now is because the region is locked down. As soon as that changes, and we would like to think that will change in the near future, then we'll certainly be setting up with a hotel in Edmundston. And in relation to how we track people, well, anybody that comes into the province has to register. So now we're able to, and we have been able to disseminate of what particular reason they're here, and then what is necessary in order to ensure that they isolate. So that's how we have contact. We know who's coming, and we will direct them in addition to our number that we have for them to call, so there's no confusion. We will direct them to the Red Cross in the particular location that works for them, and then the Red Cross kind of take it over from there in relation to how they're looked after.
Thank you. Merci beaucoup. Marie Sutherland, CBC.
Good afternoon. My question is for Premier Higgs. This mandatory hotel isolation is quite short notice for leisure travelers who are arriving home tomorrow night or Sunday morning. So they'll now have to scramble to get a hotel and change their isolation plans. I'm wondering, will there be any leeway on issuing fines for people who can't change their plans at the last minute?
The difficulty that we're into here right now is that in terms of leisure travel, we've been saying for well over a year now, please don't travel. Please do not travel out of the country. Please do avoid unnecessary travel. Leisure travel would fall into that category. So I know there's an imposition with individuals coming home, but I equally know that there may be options that they can change their schedule. And if they can't, we have to be sure that we protect the rest of the population and they don't bring something more home than their suitcase. So the point that we actually say, look, we've got to change the rules. We've got to instigate a tighter regulation. is because we can't have this variant coming in from what otherwise might be an unsuspected source. And even though we recognize that many can go to their home and they're able to isolate there, we have seen that in the past while that is not the case. There's many stops made on the way, got to pick up groceries, got to, visit friends or talk to them, and we've had problems. Well, when COVID was as it was before, we could live with that, or we managed to live with it, I should say. But right now, it could be a game changer. So yes, it's inconvenient, and I know that it's being we're maybe being difficult, but right now we're focused on the end game, and we're focused on doing whatever we can to ensure that we get to the finish line and the touchdown is scored, and we're able to move on with summer in New Brunswick.
Thank you. Jean-Philippe Hughes, Radio-Canada.
Ça va être correct pour moi, Bruce. Merci.
I'm good, Bruce. Thank you.
Dougal, Bolton Pioneer Times.
So my question is for Premier Higgs. I just had a question regarding, I don't know if you had heard anything regarding a potential use of vaccine passports now that our public actually, I'm sure with regards to the U.S. can, I'm sure that's more of a federal thing, but I didn't know if you had heard of anything planned for either provincial travel or maybe allowing dual citizens or family members to enter New Brunswick.
So we've had some discussion federally in relation to my colleagues in the Prime Minister's office in relation to vaccine passports. Nothing that's been concluded and that I'm certainly familiar with, but the reality will be that our focus is, can we get to a point where we have equal vaccination levels on both sides of the border? And that was primarily, the question that we were putting to the Prime Minister a week or two ago, when the U.S. had announced that they were moving their schedule. When President Biden announced that he was moving the schedule up by, I think, several weeks to April 19th for everyone having a vaccine, at least one over the age of 18, I think, was the announcement. Then it appeared that extra vaccines would be available. And it does appear that we're seeing more vaccines from Pfizer, so it seems that's happening. The obvious opportunity is for Canada and the U.S. to become vaccinated at equivalent levels, so we once again can open our borders as we have all been used to. So this last year has been a big imposition for not only trade, which we've managed to work with, but individuals and families and friends and communities shopping in one community or another. So we want to get back to all that, and I think the focus is going to be, let's get vaccinated to the same level, and I think supply is going to be there to do that, and that will be the focus. And whether we get to a point of vaccine passports, let's hope it's not necessary. And I think our focus is let's get the next 2 months and vaccines in arms.
Thank you, Premier. Thank you, Mr. McDougall. Mariette Brassard, Radio-Canada.
Oui, bonjour.
Hi. My question is for Premier Higgs. There have been discussions about potentially asking our neighbor state, the Maine, if they could send vaccines to New Brunswick. As of now, based on the information we have, they don't seem to be really in favor of that, sending vaccines to New Brunswick. I'm just wondering, what kind of impact would that be on your vaccination plan if Maine refuses to send us doses?
First of all, our vaccination plan is based on what information we have that Public Health has provided in relation to security of supply. So everything we're projecting right now to the end of June is all based on what is committed. Anything beyond that is a bonus. So the fact of our discussions with Maine at a very preliminary level, but I appreciate right now they are doing just what we would be doing and are doing, is we're working with what we have, and we're focused on our provinces, they're focused on their state. And what the conversation was, just to introduce the discussion that we have so much exchange of activity between our borders here and between Maine and New Brunswick, is that it is beneficial for us to be vaccinated at the same level and be able to meet that standard. So we just feel that vaccines are more available in the U.S. We know that we could vaccinate at approximately twice the rate if we had the vaccines available. But I know the situation they're in, and I know they're working hard to get their population vaccinated. I don't expect to see any surplus vaccines from them for many weeks. But it could come in late May or June, but it'll depend on where they are with their own population, and I wouldn't expect them to obviously be any different in their decision-making.
Bob Montembeau, dernière question.
Oui, bonjour.
Hello, my question is for Dr. Russell. When looking at what's happening in other provinces in terms of vaccination, for instance, Quebec and Ontario, what we're seeing is that they're a bit more advanced. For instance, in Quebec, the AstraZeneca is offered for people 45 and older, whereas in New Brunswick, it's 55 and older. Could you tell me, on a more general point of view, how you can explain that other provinces are further along than we are? So the difference in ages between provinces for AstraZeneca vaccines doesn't really have an impact on our vaccine rollout plan. It's all based on ages, and the situation between us and other provinces is very different. Here in New Brunswick, based on the percentage of vaccines that we're getting from the federal government, is the same as every other provinces. It's calculated on a pro rata basis. As we get doses, I can tell you that there's almost less than a week between the time we receive the vaccine and the time we vaccinate people. So we act very quickly here. And I just think that we're getting an equivalent percentage of vaccines compared to other provinces. And as we get them, I can tell you, it takes us less than a week to put the vaccine in arms based on age. Thank you.
Merci beaucoup tout le monde. That concludes today's update. Voilà la fin de notre mise à jour. Merci beaucoup.